Many people are diagnosed with chronic illnesses, but I feel like I am one of the fortunate people who have learned to live well with a chronic illness. In October of 2007, I was actually diagnosed with a connective tissue disease. Dr. Leal has been one of those individuals that has been part of my journey to getting well. And so I started seeing Dr. Leal in June of 2008, and she, again, has just been instrumental on my journey to getting well because she helped me to, like I said, really learn to manage the pain. I knew she wasn't just a doctor that's speaking out of a textbook. She's been through this experience, and she, what she's saying is true. It's real. When I think about Dr. Leal and coming to visit her, I often tell people that I feel like I'm going to see a doctor, a counselor, a best friend, all these people kind of wrapped up in one. When I come to see Dr. Leal, it's just so different from any other medical experience I've had, and with the condition I've had, I've been to lots of doctors. And there are some very important principles that Dr. Leal helped me understand with the pain management because, again, it's very different from other experiences that I'd had where, I'd go to a doctor and, okay, you're hurting, we'll give you some pain medication and kind of go on your way. And you sort of have the medication and it helps to alleviate the pain, but it may not address the root problem. Dr. Leal really helps her patients to understand how to manage the pain. Yes, we use pain medications, but there are so many other things that can be used, and she talks about a lot of these in her book, Living Well with Chronic Pain. When I think back to my time with Dr. Leal, there are some particular incidents that always come to mind. And one of the things that she told me in the beginning is that in her personal journey, she had reached a point of not talking about the pain all the time. If she had pain less than a 5, she would not talk about it. And if it was 5 or above, she would put a little sticker on her coat so that her coworkers would know that she wasn't feeling that well that day, so they could kind of encourage her, support her, just be sensitive. And then, of course, in her book, she talks about a lot of different techniques that can help you manage pain, things like visualization, biofeedback, and relaxation. So I learned to incorporate a lot of those as well. What Dr. Leal really helps to encourage her patients is, as her book says, to live well with chronic pain, to get that perspective back that you can have a life and you can have a good life and you can do all the things that you want to do in spite of the chronic pain.